Welcome to PPL Talking. Today, my guest is Scott Taylor, who is CEO and founder of Perx Health. Since its founding, Perx has delivered digital care programs to over 30,000 people living with chronic conditions. They work with dozens of global brands, including AstraZeneca and the leading national payers. Perx's programs engage members 40 times longer than the typical digital care programs, and they are at the forefront of behavioral change for chronic conditions, with papers published in the British Medical Journal, the American Journal for Managed Care, and the Journal for Medical Internet Research. Welcome, Scott.
Thanks for having me, Maria.
Great. Well, we're happy to have you here. And your story and company intrigues me because many of us who work with the Medicaid and Medicare population are always looking for ways to engage these members, right? And give them information they need to be as healthy as possible and live a good quality of life. So one of the stats that really impressed me about Perx was you have a very high utilization rate amongst users. I believe it's around 90% of those living with chronic conditions. So what do you attribute the success to in getting the patients to use your app?
Yeah, absolutely. I mean, I think, for us, our focus has always been on the fact that a lot of kind of digital chronic care or digital solutions are focused a lot on the what. So the functionality of the solution or what it does or what's embedded in there or the type of content, and not so much on the why. The why would a member or a patient or an employee engage with that solution. And I think a lot of the times we assume that the why is a given. It's good for their health, or their doctor has asked them to do it, or their health plan has asked them to do it, and that will magically convince a member to utilize the solution or do the kind of task that we're asking them to do. And I think for us from day one, we've always kind of approached that problem slightly differently. Actually, a lot of kind of our expertise in the founding team came from people who'd worked outside of healthcare and understood how digital products drive engagement in those other areas. And often that's not just because something's good for you or just because there's additional content. And the value proposition in a lot of digital health solutions, the real value proposition that's being offered is content about someone's condition or a survey that needs to be completed for a health plan. And for most people who may be less health literate or just less engaged in their health, that in its core is not a value proposition that's powerful enough to cut through and get people to drop what they're doing or kind of impede on their day-to-day to actually get them excited enough and motivated to take action. For us, the way that we've focused on driving that better engagement and that better utilization is leveraging some of those strategies we've seen work from outside of healthcare to drive that engagement. And you don't have to think far, other than look on your phone about the apps that you use day in, day out, and maybe a little bit more than what you'd actually like, to think about what some of those strategies might be around, intrinsic and extrinsic rewards and motivators or leveling up or streaks or social and community. And that's what we use to try to drive that higher level of engagement, high level of utilization in digital tools in health.
It makes sense, right? Like we all want to achieve, we all want to have some satisfaction, and even if it's a little thing we get to check off every day. So it makes perfect sense what you're doing. I'm curious about Medicare recipients because it may be an outdated notion, but I think some people still believe that Medicare-age consumers are not comfortable with technology. Do you see a shift in technology adoption amongst Medicare users?
Yeah, I think that's probably a bit of an unfair excuse that a lot of digital products use, that they've built a product that was probably built by and maybe initially for younger, healthier, wealthier members. And this, we fall back on this assumption of like, we try and roll out with the Medicare population. They didn't like using it. Therefore, it's their problem, not ours. It's that they don't like technology and we don't, the way that we do. I don't think that's entirely true. I mean, smartphone adoption in over 65s in particular is incredibly high. It's almost 80% of people with over the age of 65 own a smartphone. And particularly if you thought about the kind of demographic of 65 to 75, I mean, that's probably even much higher. I think, and smartphones we know have, a much steeper adoption curve than any previous technology. And particularly I think through COVID, a lot of people who may have been, smartphone skeptics have, adopted kind of smartphones and apps, whether that's to stay in touch with family or do stuff in a remote way that's safer than necessarily, being out and about. And so I think that that's probably sometimes a bit of an excuse for the technology as opposed to actually a true result. I think that, all that said, we can't assume that older patients or older members are going to use technology in the same way as a digital native. Something that might be intuitive to a 17-year-old who's been using an iPad or a smartphone since they were, a toddler, isn't necessarily going to be the same as a 70-year-old who maybe got their first iPhone or smartphone, a couple of years ago. And things like gestures or like, specific kind of, things that you might do on a smartphone intuitively, for younger generations might be different for older generations. So we've spent a lot of time thinking about that. And actually, the first cohort of members who used our digital programs were all over the age of 70, managing multiple chronic conditions. One of them had actually got a smartphone for the first time a week before. And that taught us a lot about the onboarding process. And we see that in our data, some of the really interesting trends where, older demographics definitely require a bit more hand holding to get set up. But I think the incredible thing is they have much longer retention than their younger counterparts. And I think that's kind of, if you can do that right, and if you can make, make the technology accessible to older generations, you can actually get really strong power users in kind of digital tools. And so I think it's an unfair bias for us to kind of assume that older generations don't use smartphones or don't use technology. And I think we all know that that's probably at the heart, not entirely true. It's just the type of technology and spending the time with those users as opposed to building a tool for a younger generation and then getting frustrated that, someone who's 70 didn't use it the same way as a 17-year-old.
Yeah, I think you make some really good points because we're in this age of, software as a service technologies where we just want to rapidly get as many people as we can onto our platforms, right? But you make the great point that spend a little more time up front engaging this community, and you'll have longer retention of that population and more utilization ultimately. So it's excellent.
Definitely.
So let's talk a little bit about Medicaid then. So I've been working with Medicaid populations now, I think 20 years. And I'll tell you, they are still difficult to reach because on average, our Medicaid populations are more transient than general populations, right? They might have to move homes more frequently and such. So it's often more difficult to have a way to reach them that is constant, right? So what is your thinking on the best way to provide education to these particular healthcare members through digital mediums?
Yeah, no, absolutely. And I think, there's no real silver bullet there as much as I wish there was. And I think, the reality of, kind of many of the social determinants of health for Medicaid members, as you pointed out, make it really hard to, engage them in the same way that you might a commercial population or even a Medicare Advantage population. I think, for us, in terms of actually getting them engaged in a program, our approach there has been to be, use a wide range of messaging and channels to reach those members. And so, when we think about the channels, I mean, often kind of, there's a fallback on like, we'll do an email campaign or, we'll do a text campaign or we'll do some direct mail. I think that the reality is if you're trying to maximize outreach and reach as many people as possible, you really need to be doing all of the above. Because, someone's email address may have changed, their cell phone number may have changed, their address may have changed. And ultimately, you just need to have as many shots on goal as possible to try and reach that member. And that's requires a bit of investment, but is well worth it. The other thing that we've seen time and time again is that it takes multiple touches to reach those members. So they might see the text message, not act on it, but then they get the direct mail, and now they're it triggers the memory that, oh, I did actually want to kind of engage with that program. And so multi-touch is super important. And then messaging, I mean, actually going back to kind of that how do we engage people? It's what's the value proposition here? I think the unfortunate reality is for most Medicaid members, they have a lot going on in their lives and a lot of really stressful and important priorities that are maybe cutting through and being prioritized above their health. And it's very hard to fault them for that. I mean, there's a lot of stresses involved if you're under the income threshold that constitutes Medicaid. And so, in some ways, like being able to prioritize our health and act in our own health's best interest is a luxury that, we can afford. And so I think it's thinking about that messaging of it's not just this is something that's good for your health, or your health plan would really appreciate it if you completed this survey for us. It's actually thinking about how do we kind of make this compelling as a value proposition for this individual to drop that other important thing that they might have to do or delay doing that other important thing that might be going on in their life to interact with them at the task that we want them to.
I think what you said just now is very important. So is it, our Medicaid members, they're busy with a lot of things. They may not have the luxury of time to just, do preventative health care and such. At a former company of mine, there was one engagement campaign that really struck me. It was for Medicaid mothers who had young children. And we were doing engagement campaigns on the importance of taking care of your health, right? Like be healthy type thing, and low engagement. When we shifted the message to be there for your children, right?
Sure.
Take care of your health, engagement went way up, right? So how do you get that right message that compels people to drop everything they have to do during their day to make time for healthcare?
For sure. Definitely.
Yeah. So I want to talk about another population that we at PPL work with a lot, and it's the disability community or the differently abled. What types of accommodations should healthcare apps consider for the disabled?
Yeah, it's been something that we've had the fortune to work with, a national disability insurance scheme in our experience in other markets outside of the US, and now we also work with similar populations in the US. I think there's a few kind of critical things there. Some of it's kind of relatively obvious, like things about vision and accessibility within kind of text sizing, and also things like how you're using audio there. Can you and I mean the nice thing is actually most smartphones these days have those accessibility options where it's actually about kind of just being developer friendly and using some of the tools you already have within the phone, where you can kind of make sure that if someone does have their vision kind of accessibility options turned on the phone, that actually your digital solution accommodates those, that the text isn't going off the page or doesn't now cover other elements of the app. And that's important. I think again, the only way to kind of figure those things out is by when you're testing the kind of solution that you're building, is that you're testing it with those end users. You're not testing it with a very different population that you actually plan on rolling it out with at scale. The other thing I think, is kind of interesting there is, thinking about devices and the different devices that someone might use and how that fits in with kind of their day-to-day routine. Some devices can be, incredibly complex or difficult to use if you're managing a certain disability. And I think, thinking about how that fits into their day-to-day life. And again, testing with those populations to make sure that it is, easy and accessible.
I think that's the key, right? We have a consumer advisory committee of end users, and they've given us such rich information about how to enhance our technology and make it more user friendly. So, great point you made. I have a more general question for you. As a healthcare leader, what is one area that you would like to see our healthcare leaders in general be more focused on?
Yeah, I think that there is a recognition, and I've spoken this with a few kind of healthcare executives previously. Is I think there's a tendency to try and build kind of one size fits all solutions in healthcare. We try and kind of go out to everyone, and don't really take into account the nuances of different populations, and whether that's demographic, whether that's social determinants of health, whether that's certain kind of conditions or multiple chronic conditions that someone might be managing, and how do we kind of adapt solutions for those members. I think everyone's kind of starting to realize that we can't have point solutions for every particular use case. But I do think it's important that if we are kind of adopting a solution, rolling it to a certain population, that there's real proof points in those populations, and that we're not assuming that something that works for younger, healthier, wealthier patients is immediately going to have the same impact and same results as in a higher risk, older, more complex population. And I think that's super important of just making sure we've got the right solution for the right population, as opposed to trying to kind of build something generic. Because I think if you build something generic, you kind of end up trying to please everyone, but actually pleasing no one, because it doesn't really fit with that individual's day to day.
Yeah, well said. And I think that should apply across tech and solutions broad scale in terms of healthcare. I really thank you for your insights. I really enjoyed talking with you today, Scott. Thanks for coming on PPL Talking.
Thanks for having me.